The U.S. is speeding up vaccination efforts as dangerous variants spread across the country. More than 30 states have now detected cases of the more infectious strain. They were first identified in the UK, South Africa, and Brazil. The nation has been averaging more than 1.3 million shots per day. As of Monday morning, more than 32 million total doses had been administered. And FEMA has now pledged more than $1.5 billion to states and cities and territories for vaccination sites. More than $1 million has been handed out to a dozen states in the past 48 hours, and troops have been deployed to help with vaccination efforts in the hardest hit areas. Jonathan Vigliotti reports from Los Angeles.
Tonight, hospitals in Southern California are so overwhelmed, the U.S. military has been sent in to help.
The strength that these nurses and these healthcare professionals have to do this day in and day out is amazing to me.
First Lieutenant Lana Bagwell was deployed to this hospital in East Los Angeles, one of more than 100 sent by the Department of Defense. The surrounding community is primarily Latino, a group that has seen deaths soar 1,000% since the start of November. LA's county health director calls it horrifying. The U.S. has little time to waste as the more contagious variants take hold. The variant first detected in the U.K., now in at least 33 states. And especially worrisome to public health experts, variants first found in South Africa and Brazil are just now showing up in the U.S. The vaccines could be less effective against them.
If a lot of Americans are not vaccinated, particularly older Americans are not vaccinated, I'm really worried we're going to see not just spike in cases, but we'll see more hospitalizations and a spike in deaths.
Also worrisome, a new report from the American Academy of Pediatrics finding COVID cases among children now up 12% in the last 2 weeks. The race to vaccinate continues to be urgent. Of the nearly 50 million vaccine doses distributed, 26 million have received at least one dose. Less than 6 million have gotten their second dose. All doses need to be used immediately, says Dr. Anthony Fauci.
In this way, there are no doses that are hanging around. A dose that's available is going to go into someone's arm. If a person is ready for their second dose, that person will be prioritized.
Tonight, help coming on the testing front.
These are over-the-counter, self-performed test kits that can detect COVID with roughly 95% accuracy within 15 minutes.
Dr. Jaws says mass vaccination sites like this one, along with wearing face masks, are critical to stopping the spread. The CDC's mandate requiring masks on all flights and public transportation across the country goes into effect tonight at 11:59. Elaine?
Jonathan Vigliotti, thank you. For more, let's bring in Dr. Teresa Amato. She's the Director of Emergency Medicine at Long Island Jewish Forest Hills. Welcome, Dr. Amato. More than 30 states have detected cases of the coronavirus variants first identified in the UK, Brazil, and South Africa. How big of a concern is this, even with vaccinations well underway? And what do hospitals need to be able to do to fight the new strains?
So just remember that this is a variation of the same virus. So we know that the same measures that are fighting the original COVID virus will also be effective against this variant. Wearing your mask, distancing 6 feet, avoiding large crowds, washing your hands frequently. We know that this is actually the same measures that are going to decrease the transmission of the variant. The good news is the vaccines appear to be pretty good against the variants. And when I say that, what they're looking at, what we really look at with these vaccines is hospitalizations, deaths, ICU admissions. And it seems that even with these variants, that the vaccines will be effective for those endpoints.
Well, Dr. Fauci addressed these variants at a briefing Monday, and I want to play some of what he had to say. Let's listen to that.
Viruses cannot mutate if they don't replicate. And if you stop their replication by vaccinating widely and not giving the virus an open playing field to continue to respond to the pressures that you put on it, you will not get mutations.
So, Dr. Amato, I'm just going to ask you to sort of reiterate what we just heard from Dr. Fauci there to break this down. How exactly do vaccines prevent the emergence of other variants?
So all viruses mutate. It wants to survive. It wants to be transmittable. And so that's what viruses do. They do mutate in order to become more widespread. So as quickly as we can tamper this down and stop it from replicating, the quicker we will be able to stop it from mutating. It only mutates when it replicates. And how does it replicate? It replicates when it's transmitted from one person to another. And so whatever we can do to stop that transmission with vaccines and with all the measures we use for the first variation of it, this is how we're going to get it to stop mutating. It wants to mutate. It will mutate every time it replicates. It has a chance to do it again. So we really have to think about decreasing the replication of the virus.
Well, the U.S. is averaging more than 1 million shots a day. How much of the population will need to be vaccinated before we start to see a significant improvement in the pandemic?
So, if you want to talk about herd immunity is what I think most people want to know. When are we going to have enough people vaccinated so that we can get back to life as we know it, more normal? Those numbers are going to be pretty high, somewhere, 65, 75, 85, 90% of the population. But I think what we will start to see as we start getting these vaccines into arms, we are going to see a decrease in the transmission as more people get vaccinated. And especially when we're starting to vaccinate the people that are at the highest risk. So what we're really worried about is our older adults and our people with risk factors. So the quicker we start rolling these out, 1 million a day is wonderful. We still have work to do, but we'll start to see some decrease in the transmission as we start to get more into the double digits, more into the 20, 30, 40, 50% of the population vaccinated. So it's going to be a big effort, but I do think that there's a big commitment now to getting these vaccines into arms. That's what you've been hearing at every level of the government and every level in healthcare, vaccines into arms.
So on Friday, Congressman Stephen Lynch from Massachusetts tested positive for COVID-19 after already receiving his second dose of the Pfizer vaccine. Dr. Amato, help us understand, how is this possible? What should people know right now about vaccines and the spread of the coronavirus?
So when you say a vaccine is 95 to 98% effective, that means it's not 100%. It's not 100% effective. So you are going to occasionally see people that will actually get the virus. However, what we have seen with the vaccines is that they're highly correlated with lack of hospitalizations, ICU admissions, and death. So even if you were to get the COVID virus after your vaccine, which is very unlikely, but if you do, what we can say is the chance of you getting very sick and requiring to be hospitalized, be in the ICU, or even dying from COVID is greatly diminished with the vaccine.
Such an important point, Dr. Teresa Amato. Doctor, thank you very much for sharing your insight with us. We really appreciate it.
Thank you so much for having me.